My name is Woodliff, and I'm a mindfulness-based stress reduction teacher and psychotherapist for over 25 years. Today in this brief video, I'd like to introduce you to mindfulness meditation and invite you to a short practice. So please feel free to participate if you'd like to. Mindfulness meditation is scientifically validated and a simple tool which helps us to respond rather than react to our stressors. Research tells us that if we practice consistently, we can rewire or restructure the brain. Mindfulness or learning mindfulness is a lot like developing a muscle or learning a new instrument like playing a piano or a trumpet. It takes practice, and it takes time, and it takes intention. And most everyone is able to learn mindfulness just with a little bit of training. Not only is mindfulness a tool to help us reduce stress, it can boost the immune system, improve attention, and promote health and wellness. One way to think about mindfulness is that mindfulness helps us to change the channel in our mind. Let's say that we are on the channel of worry and rumination about the past. We can change that channel with mindfulness by knowing that that's what we're thinking and change it to a more productive way of thinking, such as coming into the present moment and looking at the clear blue sky or hearing the children's voices as they play. Whatever it is that we want to shift our attention to, we have that choice to change the channel. Many times throughout the day, I'll say, Kathy, change the channel. So it's just a little reminder to think about what is happening right now in this moment. A definition of mindfulness is the awareness that arises when we're paying attention to our present moment experience with openness and curiosity and a willingness to be with what is. We can bring that quality of awareness to little things throughout the day. We can bring that to walking or brushing our teeth or washing our hands. Whatever it is that we are doing in our normal daily activities, we can bring a mindfulness to it. Jon Kabat-Zinn, who first brought mindfulness to the mainstream, taught mindfulness in a hospital setting with chronic pain patients over 40 years ago. Today, in all integrative medical centers and throughout the world, mindfulness meditation is being taught. Not only there, but we also find mindfulness in education, psychology, corporate America, sports, and even in police academies. So it's being taught in all walks of life. For many people, mindfulness is more than just a mind training. It's a heart opener. So what we're doing is we are cultivating gentleness and kindness, as well as attention and clarity. So let's begin this practice. And what you can do is you can just watch if you like, or if you would like to participate, you just need to simply follow these instructions. So we'll begin by sitting, and in meditation you can stand or lie down, but for our purposes today, we're going to just sit. And we want to sit upright and relaxed, and also we'll place our hands either loosely in our lap, or we can place our hands on our thighs, whichever feels more comfortable for you. Our feet are firmly planted on the floor, and we don't want to cross our feet because we don't want to cut off any circulation. And the eyes can be closed, or we can lower our gaze about 6 feet in front of us. So I close my eyes, and we'll just start, and you do whichever you like. Close your eyes or lower your gaze. So we'll begin by taking a couple of nice deep breaths. And we'll begin with a brief body scan before we begin our practice of mindfulness of breathing. And so we'll draw our attention to our heads. And notice if there's any tension around the temples or the eyes, or if there's any tightness in the jaw. And just feeling into this body. Moving to your shoulders and rolling your shoulders a little bit, first backwards and then forward, so that they can be relaxed. And feeling the thighs against the cushion of the chair. And then feeling the feet planted firmly on the floor, to get a real sense of groundedness and rootedness in this posture. So we'll begin by welcoming ourselves to mindfulness of breathing. Checking in with this mind and heart and body as it is now. And bringing our attention to the breath, the inhalation and the exhalation. You may notice that the breath is more prominent in the nostrils or the upper lip. It may be more prominent in the chest or the belly area. But wherever it is, place your attention there. We're feeling the breath. We're not thinking about the breath. Feeling the sensations of the inhalation and the exhalation. Breathing in, I know I'm breathing in. Breathing out, I know I'm breathing out. Breath by breath. Moment by moment. The mind may have wandered by this time, because that's what the mind does. And we are training the mind to come back to the breath. So we gently and without judgment bring the attention back to the sensation of breathing over and over again throughout this practice. You may be distracted by a sound or possibly an emotion. And once you realize that you are no longer focused on breathing, you have become mindful. And then you simply bring your attention back to the sensations of the inhalation and the exhalation. Breath by breath. Moment by moment. Breathing. Being present in this moment with the breath. And as we come to the end of this mindful breathing practice, congratulate yourself for taking a few moments to cultivate kindness and gentleness and attention towards yourself and ultimately towards others. And whenever you're ready, you can open your eyes. Thank you for your practice. Thank you for joining me today. And remember that you can do this practice many times throughout the day, each day. Hope to see you soon.